I'll be demonstrating how to give an IV medication via CIVA today. So I'm going to start off with hand hygiene. I've already checked if my doctor's order matched my medication administration record, and it's all good. It was transcribed correctly. So I'll be pulling my med from Pyxis, and I'm just going to do my first check here. So the right patient is Emma Wrightenson. She's a 30-year-old. She's allergic to morphine, so that's good to note. So here, the right drug is Furosemide, which is the same thing as Lasix, so we're good for the drug. Right dose is 40 milligrams, so I have 10 milligrams per ml here, so that works. The right route is IV, and it says I can do IV on here, and it's once daily now via CIVA. So I'm just going to look at the Furosemide here and make sure that there's no expiration date, so we're good for the expiration date. I'm now just going to look at my medication, or my monograph. So yeah, Furosemide, it's also known as Lasix. It's a diuretic or an antihypertensive. It says that it can be administered by a student nurse, so we're in the clear. And for IV continuous, the usual dose is 10 to 40 milligrams per hour. I'm sorry, for the usual dose, it's 20 milligrams to 80 milligrams. So we are good because 40 milligrams is in between that. So we're doing it through CIVA. I'm just going to look here for any potential hazards and side effects and note them so I can notify my patient and monitor for them. So once that is all done, I'm going to get my medication ready. So because it is supplied as a 10 milligram per ml and I need 40 milligrams, I did the calculations and I need 4 ml drawn up. So I'm going to first do some hand hygiene here, and I'm going to also swab my Furosemide here for 30 seconds and let it dry for 15, but for the sake of the video, I'm not going to do the whole thing. I'm going to grab my 5 ml syringe, as I need 4 ml drawn up, and I'm going to grab my blunt fill needle. And I'm just going to make sure that both of these ends remain sterile, and twist these on here. So I'm going to be drawing up 4 ml of air that I'm going to push into the vial so that there will be less pressure. So 4 ml of air. This is already swabbed. So I'm going to go in. Air.
October 16th, and I have my name on it.
Invert it.
2 p.m. Now I'm ready to go to the bedside. I'm entering the room, and as I enter, I'm going to do a safety check, make sure the bed rails are up.
Okay. I'm going to put my needle back on using that scoop and swoop method. And I'm just going to pull back here and get out any bubbles that are here.
So her first and last name and her patient armband matches the mark. And I'm just going to assess her IV site to make sure it's okay.
I'm just going to pull up there.
Do you have any notes?
So I'm going to put the rest of the medication into a sink until I get the right dose.
Side is okay. And I'm just going to make sure that the primary pump is running at the correct speed.
So I have 4 milliliters here of Furosemide. So I am now going to do my second check with my needle and my vial here. So the right patient is Emma Wrightenson. Right drug is Furosemide or Lasix, which I have here. Right dose is 40 milligrams, so I have 4 ml here. Right route is IV, and the right time/frequency is once daily. We're going to do that now, so we're going to do that during CIVA. So I'm going to now put this away here, and I'm going to flip to the CIVA chart here. So the CIVA chart here says for a dose of 40 milligrams that you're going to have 5 ml in a 10 ml syringe. The pump setting is going to be normal, and the time to infuse will be 13 minutes. So because we already have 4 ml, I'm only going to drop 1 more ml of normal saline. I'm picking normal saline just because that is the standardized for CIVA. So I'm going to grab a 3 ml syringe and grab a new blunt fill and my normal saline. So I'm just going to check my normal saline, make sure that there's no expiration date or anything, it doesn't, so good. I'm gonna alcohol swab it now for 30 seconds and let it dry for 15. Give it a good swab to make sure. And I'm now gonna wing back my packages here, ensuring that it's sterile once again, and putting my blend film needle on. I'm gonna pull back to 1 milliliters of air to inject it into the vial. Push it in.
Now I'm going to get secondary bag.
1 ml. Once again, I'm going to use the scoop and swoop method to put my needle back in, and I'm going to pull back and get out any air bubbles that I have.
Now I'm going to put in the secondary pump rate.
So once again, I do this over a sink
mLs
and go to 1 ml
per hour.
just to show you. I have 1 ml of normal saline here. So we need to put this in a 10 ml syringe. So I'm going to grab my 10 ml syringe, winging it back. I'm just going to pull down on it, just as much as it goes. And I'm going to first grab my Furosemide here, my 4 ml, and inject it in here.
So Emma, you may experience some nausea, vomiting, and diarrhea with this medication.
I'm now going to cap this and put it in the sharps container. And then I'm going to put the 1 ml of
the secondary line, so other
normal saline in.
Know when to change the bag and when to actually.
Once again, putting that in the sharps containers. So I'm just going to get any bubbles out that I have here. Just making sure that none of the medication leaves.
I'm also going to document on the mark for when people know when I gave the medication. We gave it at 2:10.
Okay, so now that I have 5 ml, I'm just going to cap it here with this little cap. Make sure it's sterile. And I just have one little hole here. Okay, so I now have 5 ml in total. So I'm going to now make my medication label, which I already made. So it just says the drug name, which is Furosemide, the dose, which is 40 milligrams in 4 ml. It's diluted in 1 ml for a total of 5 ml, and the concentration per ml in this syringe is 8 milligrams per ml. So I'm just going to put the label on somewhere you can't see. And I'm going to grab all my supplies to go to the bedside. So I'm going to grab my micro drip tubing, I'm going to grab alcohol swabs, I'm going to grab the medication, I'm going to grab my MAR, and my tubing label. So I'm going to walk into the patient's room, do my hand hygiene, do my entrance safety check. So I'm going to put the bed rails up, all the fun things, put that bed rail up too. Hi, I'm Leanna. I'm your student nurse today, so I'm just going to be giving you your Furosemide today via your IV. Your Furosemide is just, it's to help with your edema that you have. I'm just going to check your wristband here against my MAR, and then I'll tell you a little bit more about your drug. So I'm just going to check here. So right patient is Emma Wrightenson. The date of birth is 30 years old. The allergy band confirms that it's morphine. Would you be able to tell me your name, please? Emma, okay, and your date of birth. Okay, and do you have any other allergies than your morphine? No, okay, sounds good. So yeah, like I said, the Furosemide is for your edema because you came in with fluid overload. You may experience some dizziness, a headache, some nausea, vomiting, so I'll put the call bell near you, and if you're experiencing any of those symptoms, just give me a call and I'll come check you out. I'm just going to do my third check here. So I have emeridicin, right drug is Furosemide, right dose is 40 milligrams, right route is IV, and it's once a day. So I'm just gonna grab my tubing out here. So I have micro tubing here. I'm gonna take the cap off here and take this cap off here.
Well, it looks like there's no signs of inflammation or colitis. And you put your hand in your eyes to study? No? Okay.
Okay, so I'm just capping this. I'm gonna make sure that the right solution is flowing, that it's compatible with what I'm giving it, which it is. There's no expiration date on the tubing, or it's within the time on the tubing in the bag. And I'm going to make sure the right flow is flowing, all the clamps are open, and I'm going to assess the IV site for redness, coolness. If it's red, I'm just going to ask the patient, is there any pain at your IV site? No. Okay, so I'm going to make sure the clamp is open here, and I'm going to take this off, and I'm just going to slowly prime this line very slowly until I see a little bleb. So I see the bleb now. I'm going to put this back on. So I'm going to grab the CIVA pump here. I'm going to put my syringe in the CIVA pump. I'm gonna put this down, so this will confirm, yes, it's 13 minutes. So I'm gonna swab the site here, so you can use any of the ports, but I chose to use the one closest because they're not on any IV medications or anything. So I'm just gonna swab the port for 30 seconds, let it dry for 15. Connect the tubing here.
So I've already went through and ensured
And it said to start normal, so I'm going to start normal. And I'm just going to assess the patient, see if they have any allergic reactions, stay with them for 3 minutes. And I already stated the side effects, so they can call me. And yes, so I will clean up my stuff, and I'll do the exit safety check and leave.